Hello beautiful people, welcome again to my channel. I am yourbabysdoctor, your baby's doctor, and it is always a pleasure to have you on this channel. So today we'll be talking about constipation, which is also a very big problem for children. I hope by the time we are done with this video, you would have known what constipation is, you know what it presents as, you would know the home remedy to use and when to visit the hospital. So like I always say, it is always nice to have you here. If you're a new person on this channel, it is always nice to have new people here too. So please click the subscribe button, click the notification bell so that you can get notified each time I post a new video. Let's get to it. Constipation can be defined in a number of ways, and it depends on the child's normal habits, the child's normal bowel habits. So it can be defined as when a child does not move bowel for up to 3 times a week, or when the consistency of the stool is hard. So these are some of the things that can define what constipation is. So constipation, nobody likes to be constipated. It is a very, very uncomfortable feeling, either for a baby, for a child, for even an adult. You know how it feels. You feel bloated, you are cranky, you are angry, you can't eat, you can't enjoy yourself when you're constipated. And it can be defined in a lot of ways, but I'll choose 2 definitions that will help us in today's video. The first one is when a child fails to move bowel up to 3 times a week. So we expect that your child should actually move bowel 3 times a week. So when child fails to move bowel up to 3 times a week, we can say that the child is constipated. Another thing that we would see that will make us say a child is constipated is when the consistency of the stool is hard. So the child is passing hard, pellety, in some cases it looks like pellets, small pellets and stools, and they are very difficult to pass. You can see the child straining and grunting just to pass this stool. Then you can say the child is constipated. So there are a number of things that can actually cause constipation in a child, and I'll be mentioning a few of them. Like if I have to mention all the things that can lead to constipation, I'm sure this video will be like an hour long, and we don't really want a long video. So I'm just going to pick the very common short things that we can discuss in this video. So the first one is when the meals are not well constituted, and this is more specific for children that are formula fed. So like I said in the last video, when you buy a tin of formula feeds, you should always read the instructions that are written at the back of the tin. Usually they will tell you how to constitute the feeds. So when you don't do this right, that is the ratio of water to the formula feeds is low, then your child is at a risk of constipation. Also, formula fed children, of course, are not exclusively breastfed, which means that you have to give them water after feeding them. So a lot of people don't know this. They just give them the milk and think that is it. If you are formula feeding a child, you need to give them water. So those are some of the things that can cause constipation in a child that is formula fed. In older children, those are the ones that are now after 6 months, you have introduced a family diet, solid food, semi-solid food. Some of them can be constipated, especially when you don't have enough fluid, fruits and vegetables in there. Another cause of constipation, which is more common in older children, I'm talking about children past the age of 6 months. So these are children that you have introduced to solid, semi-solids and family diet. These children, when they have low fruits and vegetables in their food, they can also be constipated. Also, sometimes we don't give our children a lot of water to drink. This can also lead to constipation. Now, this one is usually very funny, and it is when you're toilet training your child early. So yes, a lot of people believe that you should actually toilet train your child early in life so that they can get used to it before they even clock 1. But in some cases, not all the time, when you toilet train your children early, they become rebels in the sense that they decide intentionally that they are not going to stool when you place them on the potty to do that. So when they do this, what they started doing voluntarily, like I'm not going to stool, whether you like it or not, you have placed me on the potty, I'm going to sit down here till afternoon and I'm not going to stool. Okay, so this was initially a voluntary thing, and then subsequently it becomes involuntary. The body gets used to it and the child stops stooling. So the child will not stool in your potty and the child will not stool in the diaper. Weirdly so. A child can also become constipated when they start withholding stools. And this occurs when a child is in an unfriendly environment or goes to, like, let's say school where the toilet is not good, the toilet is not okay, the child does not want to stool in that kind of environment, the child is scared for some reason, or you change the child's environment. This can lead to withholding of stools. So what happens is that the person or the child starts to voluntarily hold the stool. Like, okay, I will hold it till I get back home. I will hold it till I get to a very comfortable environment. And then the body adapts to this and decides not to move the bowel. So this also is a very common cause of constipation in children. The last cause of constipation that I would like to discuss on this channel today is intestinal obstruction. Now, this is in no way to scare you. I'm not here to scare you. I'm not telling you that the fact that your child is constipated means that your child has intestinal obstruction. But I just have to tell you the causes. I have to tell you the facts so that you can seek medical help when the need arises. So intestinal obstruction is also a cause of constipation. So now that we have talked about those causes of constipation, I would just want to mention again briefly, like I had mentioned earlier, on how constipation would present. So you have a child that would normally move bowel daily, but has suddenly stopped moving bowel and now moves bowel less than 3 times a week. The child is constipated. Another scenario is a child that starts grunting and straining just to move the bowel. That child is constipated. And those are the usual signs and symptoms that you would see in a child that is constipated. Other signs and symptoms will be pointing more to a dangerous side of the story, which will be, well, the child becomes bloated, the child is refusing feeds, the child is cranky and all that. So your child is constipated. What are the things you need to do? First, you need to look for the cause of the constipation. I'm talking about reconstituting the feed. So if you feel like, okay, your child is a formula-fed child, and you notice that, okay, instead of putting 3 scoops of formula feeds into 1 of water, however it is written at the back of the container, please follow the right steps. Do what they tell you to do. They are the producers and they know exactly what the ratio and the measurement should be. So please follow the instructions strictly at the back of the container of your formula feed. Next, if your child is older, now you have started semi-solids and solids and family diet, you will need to introduce fruits, vegetables and water into your child's meals. So don't worry, your child can have fruits and vegetables. If you feel like these fruits and vegetables are a bit hard, you can puree them. What I mean is you boil them a little, just a little, put them in a blender, blend it. You can even make them into smoothies and give your children. This way you will increase the fiber content of their diet and they are likely to move bowel better with a high fiber containing diet. Now, like I said, water is very important. So your child has gone past the age of 6 months and has started eating the food you eat at home. Please give your child enough water. You need to give your child enough water because the more the water content in the stool, the looser it becomes and the easier it is for the child to actually move bowel. So please, you need to add more water to your child's diet. Like I always emphasize on this channel, the role of supporting your child is very important. The same way you support your child in other areas, you need to support your constipated child. You need to let them know the reason why they need to move bowel, especially for those that are withholding their stools. You need to let them understand that frequent bowel movements will reduce the risk of them having constipation. Okay, so together you're supposed to create a routine for moving bowel. So you say, okay, early in the morning, we are going to go to the toilet and you're going to try to stool. So that way you can create a new routine for your child to actually move bowel. So the role of your support is actually very, very, very important in a child that is constipated. Like I said, do not panic. You have tried all the means. Some people have mentioned the use of castor oil and laxatives. Please, before you use laxatives in whatever form at home, please reach out to a medical practitioner for you to get approval for such medications. Okay? Because whatever will make you need to use laxative means that you actually need medical help. So please go to the hospital and let them be the ones to prescribe you the laxatives to relieve your child's constipation. So having said all that, I would like to mention some things that are like red signs. When you see them, you need to go to the hospital. Don't say because your baby's doctor said that constipation is not a serious thing, you now keep your child at home. So if you have tried reconstituting the feed, you have tried increasing the fiber in the diet, you have tried giving water, and you have tried even the behavioral modifications and the routines and all that, and your child is still constipated, please go to the hospital. Another reason you should go to the hospital is when your child starts refusing feed. So your child is not stooling and then is not collecting food from you again. You are trying to feed, the child is not collecting the food. The child is now very cranky, crying and crying unconsolably. Please, it is time for you to go to the hospital. If your child has now developed fever, the child is looking sick, not playing and all that, please go to the hospital. If the child's abdomen is now very big, or even if you don't even have to wait for it to be very big, the abdomen is getting bigger and you can actually notice that this abdomen is actually getting bigger, please, it is time for you to go to the hospital. Now, a very important one is this, because when the child is constipated, the child is likely to be straining so hard to push down the stool, and in the process this can actually cause a tear in the intestine or the rectum, or can even prolapse. That is, the part of the intestine can actually come out through the anus. So if you notice that there is a part of your child's intestine that is actually protruding, or something is protruding out of your child's anus, it is time for you to run to the hospital. If you see blood in your child's poop, always, even when the child is not constipated, it is time for you to go to the hospital. Please, if you have tried everything at home, you have done everything, you've used your own remedies, those routines, you've changed the diet, you've added fiber, you've given water, and your child is still constipated, it is now beyond you. It is time for you to seek medical help. Constipation, as simple as it is, like I said, might also mean something sinister. So you have tried to manage the constipation at home by yourself and you are not getting results. Please do not go to Google to look for advice on what to do. It is time for you to go to the hospital to get medical help. So that's it today on constipation. Remember that the causes of constipation, like I said, can be due to poor milk reconstitution, can be due to poor fluid or low fluid or vegetables or fibers in your child's diet, can be due to some changes in your child's routine, and it can just be that your child is stubborn. Okay, I'm talking about those children that you want to toilet train and they want to show you that you are not going to, those generals, they want to show you that you are not going to toilet train me. These are some of the causes, and I've told you the symptoms of constipation. The child is not stooling more than 3 times a week. The child's stool is hard, it's pellety, the child grunts to stool, there is blood in the stool. Those are some of the symptoms of constipation, and I've told you the things to do. But please remember those red signs, those red flags. Once you have them, it is time for you to go to the hospital. I remain your baby's doctor, shining light on your child's life.